Hello everyone, I'm Russ McLean, Chair of the Patient Voices Group. The Patient Voices Group is a small charity which acts as a critical friend to health and social care services across Pennine, Lancashire. Our aim is to improve access and quality of services through actively engaging with healthcare providers. Now, today I've come along to the Royal Blackburn Teaching Hospital to put patient concerns and questions to Mr. Kevin McGee, who's the Chief Executive of East Lancashire Hospital's Teaching Trust. Hello, Mr. McGee.
Hello, Russ. How are you?
I'm fine, thank you. The NHS is under severe pressure. Rising numbers of patients need hospital care, whether that be in an accident and emergency department, or for cancer treatment, or for planned operations and care, such as knee and hip replacements. Growing numbers of people are also reporting that they're struggling with their mental health. For each area, there are strict targets. Local services are expected to meet right across the UK. Now, Mr. McGee, according to the NHS tracker, you are failing to meet your targets, specifically A&E and planned operations and care within 18 weeks. To put this into context, the way A&E targets are measured is almost identical across the UK. Now, in each case, services across the UK are given 4 hours in which to treat and discharge or admit or transfer a patient. Your trust last met that target in June 2015. Now, the one that varies the most is for planned hospital care, which is also known as non-emergency treatment. In England, Wales and Scotland, the target measures the point at which you get a referral from your GP to the point that your treatment starts. In effect, the whole patient journey. In Scotland and England, services have 18 weeks. Your trust last met that target in December 2018. So, Mr. McGee, your trust is failing to meet those targets. What are you doing to put it right?
So generally, the trust is considered to be one of the best trusts in the country in terms of hitting targets. We have traditionally hit all our cancer targets, our 18-week targets, and we have unfortunately been failing against the A&E target, but most trusts in the country, again, unfortunately, have been failing A&E because of the demand and the activity coming into the system. We're doing lots of different things. So one of our biggest pressures is workforce. So we're looking for additional doctors and nurses to support our A&E performance and putting additional resources in. We're also doing what we call same-day emergency care. So patients, rather than just coming into A&E, can actually bypass A&E and they can go, say, if they've got a respiratory condition, can go into our new respiratory assessment unit, or they can go into our older people's units. So there are different ways that we can take the pressure off our A&E department. But it is fair to say that our A&E department, it's the busiest in the Northwest. We're seeing increasing numbers coming through the door, and it is under continual strain. However, one of the really positive things that I can say is that we've been granted 10 million to increase the size of our A&E and our emergency floor. And actually the work on that starts within any day now. The spades are going to go in the ground in the next week or so. It's an 18-month build, and so that will make a tremendous difference to the size and the physical layout of our A&E department. Along with that, we're looking to recruit more staff, and that will allow us to manage the throughput in a better way and help us deliver the target. But I keep coming back to this point, it is an incredibly difficult target to meet, given the level of demand that comes through the door.
Yeah, I think I'd say in fairness, of course, your trust is only one of many across the country that isn't meeting that target. And I would like to point out that your trust is meeting its cancer targets. This target expects patients to be treated within 62 days of an urgent referral. So congratulations on that.
No, thank you. And we work very hard at trying to hit that target. And as I say, generally, our performance against the vast array of targets, because we have hundreds of targets that we need to deliver against, generally we're seen as being one of the better performing trusts.
Now, I'd like to talk now about the Point Prevalence Survey. So this is a national directive where all patients occupying a hospital bed are seen by community nurses and or surveyed against a set of potential harms. And these harms are falls, existing and acquired pressure ulcers, catheter-associated urinary tract infections, and venous thromboembolisms. Last month, you reported that 99.28% of your patients received harm-free care, against a national average of 97.97%. So surely that's great news for staff and patients.
I think this is probably the most important measure that we undertake. So think about harm-free care. It relates to things such as pressure ulcers, falls, etc. And we undertake a survey every month to see, just to understand the quality of care against a basket of measures, quality measures. And we every month score very, very highly against these indicators. Now, we work very hard at this, so we've done a lot of work around the likes of pressure ulcers. We've done a lot of work around the falls. And it's really important because this is such an indicator of quality, basic quality of care on the wards. And this was the one that would worry me more than anything else if we weren't getting it right.
Yeah, because patients and their families often remark to me that the NHS seems to be obsessed with targets and surveys, and they wonder if patient care really does improve as a result of a survey. What are your thoughts on that?
Well, there is a saying that what you measure, you focus on. So I think targets are quite important, but they have to also be taken with other measures such as quality of care. And sometimes you can't always measure things such as friendliness, things such as calmness on the wards. Are people being treated with dignity and respect? And I think all of those measures together, along with some of the hard activity measures, you should look at them in the round.
Well, one of the surveys that most patients will be most familiar with is the FFT, or Friends and Family Test. Now, according to that measure, you seem to be faring less well. Last month, the Friends and Family Test for your own A&E was down to 86.4%. Inpatient services were down at 98.3%. Community services were down to 95.6%. What's your explanation for this? And how upset do you and your staff get when presented with figures that obviously show a decline in patient satisfaction?
So the Friends and Family Test is measured every month, and the figures that we receive are still very high. But because it's a monthly test, they can fluctuate. I would be worried if we had a number of months, say 6 to 12 months, where we had a declining performance. So this is only 1 month. I'm not complacent about it, and we need to see how it picks up next month and the month after, etc. But I'm not, at this stage, I'm not too worried because it is only 1 month.
And of course, I should point out to our listeners that your maternity services Friends and Family Test was up to 96%. So that's also good news.
It is good news, but exactly the same. You just can't take the data from 1 month. You have to have a number of data points over 6 to 12 months before you can really understand what a trend is saying.
Now, Mr. McGee, several patients have contacted the Patient Voices group who seem to be concerned that their elective surgery has been cancelled at the last moment. So elective surgery, of course, refers to planned operations. The question was, if these operations were planned, why are so many being cancelled? Of course, I don't expect you to comment on individual cases, but don't you accept that the cancellation of any operation, in fact, has the capacity to have a negative effect on that patient?
So I would not wish, in an ideal world, I would not wish to cancel any operations at any point in time. I understand the distress it can cause to patients and their families if people are planned to come in for operations and then we cancel it at short notice. It shouldn't happen. Unfortunately, we've been under extreme pressure through the winter, and that pressure has only got worse actually as we've got into April and May. And that's because of the number of people coming through on the emergency pathway, coming into A&E that then need to be admitted into the hospital and beds. And always emergency patients will take preference over planned activity. I'm hopeful as we go through into sort of June into summer, the pressure in our A&E department will start to ease slightly, and that will allow us to make sure we cancel less operations or no operations going into the summer. So you're absolutely right, Russ. It shouldn't happen. It's not good for patient care, but sometimes we have to prioritise emergency patients over elective patients.
The Health Secretary, Matt Hancock, has ordered an urgent food review after 2 more patients died because of an outbreak of listeria. The number of deaths related to pre-packed sandwiches and salads at hospitals has risen from 3 to 5, according to Public Health England. Products from the Good Food chain, which supplied to 43 NH trusts, have been withdrawn and production halted. Mr. McGee, my obvious question is your trust supplied by the Good Food chain, and what is your trust doing to ensure that patients' food is safe?
So I'm not aware that our trust is supplied by the Good Food chain. We take food hygiene and the quality of the food very, very serious. And it's something that we do an awful lot of work. We've got very competent, very experienced professionals looking at all of our food, where it's sourced from, how it's prepared, how it's delivered to both patients and staff, and we try and deliver that and do that to the highest standards possible. So we recognise that actually good quality food is important for patient care, for patient satisfaction, and helps their recovery. It's also important that our staff are fed appropriately and have good quality care. So I am actually proud of the quality of the food that we did serve within all of our hospitals and our community premises, and it's important that we keep doing that, and we will keep pushing to make sure we deliver the highest quality of food.
Now, you've recently held your annual Star or Staff Thank You and Recognition Awards at the Duncan Hulsh Hotel. Mr. McGee, can you please explain why you think it's a good idea to recognise your staff this way?
I think it's plainly obvious that we need to recognise our staff. They do an awful lot of hard work, they give an awful lot of discretionary effort, and there's a lot of very good, strong empirical evidence to show that if you look after and support your staff, they can deliver better and higher quality patient care. So it's vital that we look after our staff. I make no apology for things such as the Star Awards, and in fact, if I could do more in terms of recognition of the staff, I would absolutely do it.
And am I right in thinking it's not something the hospital pays for anyway, is it? It's not something the trust pays for?
We do this through donations, we do this through looking for sponsorship, and when we have the Star Awards, the staff pay for their own tickets.
It's been widely reported that since May 1st this year that you've been acting as an interim CEO for Blackpool Teaching Hospitals Trust. You've taken over at a particularly difficult time where 4 healthcare professionals have been arrested on suspicion of administering poison to patients. I wouldn't, of course, expect you to comment on that, but this must be devastating for staff and for patients. What are you doing at that trust? And how are you able to split your time between East Lancashire and Blackpool and still provide that safe, effective care for the patients at your own trust?
So I see very, very good, high-quality care delivered at Blackpool, and I see brilliant staff who are working incredibly hard. My job over the next few months, until they appoint a permanent chief executive, is to support the staff and to provide leadership to continue to deliver the highest possible care. I can do that because I've got excellent teams at East Lancashire, and East Lancashire is in a very strong place. And it's really important, I think, that as we go forward, trusts in Lancashire help and support one another in a better way. The biggest problem I've got now, and the biggest problem we've got to delivering high quality care, is staff shortages. And so what will become more and more apparent, I think, as we go forward, is the trusts in Lancashire, the hospitals in Lancashire, are going to have to work closer together, are going to have to work in greater collaboration together. And this is a good example of how East Lancashire is stepping up to the mark and really helping other organisations.
The Healthier Lancashire and South Cumbria Integrated Care System, or ICS, has recently decided to commission an independent review of urgent mental health services. Now, in my opinion, that is long overdue. But tell me, Mr. McGee, how did East Lancashire Hospitals Trust contribute to this review, and how do patients with mental ill health impact on your trust, given that you are, of course, not the provider of mental health services in East Lancashire? And just what exactly is your trust doing to care for the mental health patients who are in absolute crisis when they present at your A&E?
So you're right, Russ, we're not the provider of mental health services within Lancashire, but what we're seeing more and more of is patients who come into our A&E department are presenting with both physical and mental health issues. So what we have to do is when they come in, and patients of that nature come in, we deal with their physical issues. We then refer those patients on to Lancashire Care Foundation Trust, and those patients are assessed for their mental health needs and issues. Now, we have had occasions when there's been a shortage of beds within Lancashire if a patient's been assessed as needing a psychiatric bed, and therefore those patients have waited longer than you would have hoped for and expected within our A&E department. So that's what the review was, to look at how we can reduce to a minimum the length of time patients have to wait within in A&E. I think things are starting to improve. We've got a new leadership team now in at Lancashire Care Trust, and they're making some real differences. And the system is trying to pull together to support patients who have got both physical and mental health needs. But you're absolutely right. No patient should wait longer in A&E than they need to.
Let's talk now about volunteers, and East Lancashire Hospital Trust has over 250 volunteers who work in different roles supporting hospital staff. But how would someone who is interested in becoming a volunteer go about that, becoming a volunteer, and how important are volunteers to you and the Trust?
So volunteers are absolutely vital. As you say, we've got 250 plus. It's probably, I think, closer to 400 volunteers that we have working within the hospital, and they do everything from, manning reception to supporting on some of the wards, handing out sort of teas, coffees, etc. But we have volunteers that work right the way across the organisation, and what they do for this trust is fundamental, and what they do for our communities and our patients is absolutely fundamental. So I'm really, really pleased with the number and level of volunteers that we have. We're always after more volunteers, and I'm delighted if people would come forward. The easiest way actually is just to look on our website, and there's links there about how you can go about volunteering, and it gives you the information that you require and the routes. But what I do find is that when I speak to volunteers, they find the role extremely fulfilling, and they get an awful lot back from the role. So I would encourage as many people as possible to volunteer.
Let's move on to a contentious issue. The local press has recently reported that patients and their visitors seem to be extremely unhappy at the apparent inability of your trust to stop people from smoking on its premises. Now, whether we like it or not, smoking has become extremely antisocial. But what are you going to do to ensure that patients do not smoke in public areas, and particularly at your main entrances?
So this is a no-smoking hospital, and what we've done to try and support patients who smoke is to do a lot of education. So if people are smoking on the site, which they shouldn't do, but if they are, we continually challenge patients. We continually try and support them to educate them reasons why they shouldn't smoke on site, and to support them with stop smoking campaigns such as patches, etc. We continue to do this, and we will continue to do this. However, it may well get to the point in the near future where we'll have to take more stricter enforcement measures, and if people are smoking on site, we will physically have to ask them to leave the site, and we'll enforce that.
I'm sure that'd be good news to a lot of patients across East Lancashire. This year, 75 years have passed since the largest seaborne invasion in history, commonly known as D-Day. Well, it will come as no surprise that a number of your trust staff are either veterans or are serving within the reserve forces. In 2017, ELHT, or East Lancs Hospital Trust, received a silver award under the Ministry of Defence Employer Recognition Scheme. Can you tell me a little bit more about that scheme and how ELHT support our reserve forces?
We have a number of reservists working within the organisation, and they can be all disciplines: doctors, nurses, porters, electricians, right the way across the organisation. We encourage staff to do this and to become reservists. We do this through various ways, simply by publicising what these roles are, but also by making sure that people get the time off and are supported to have the time off to undertake their duties if they become a reserve. It's within the armed forces. So it's something we absolutely support from ELHT, and it's something that we would encourage as many staff as possible to be part of.
East Lancashire Hospitals Trust has switched from a traditional letter-based appointment management system to a digital patient portal, saving a reported £120,000 a year and freeing up 30,000 reusable appointments. The Trust processes 450,000 outpatient appointments a year across 5 hospitals and 17 community nursing locations in East Lancashire, and of course Blackburn with Darwen. The patient portal was launched in July 2018, and by just September of that year, 54% of patients had opted to receive their appointment letters and other information digitally, cutting the cost of appointment letters by 51%. It's a huge saving, but what do you do with that money?
So, as with virtually every hospital, not just in this country but the world, we believe we could always do more, because we have more patients coming through the door. We need to employ more staff, and technology is always changing, so we need to invest. So that savings target that we've been given, also every year we have to hit a savings target that can be between 2 to 3%. So for us, that's around about 15 to 17 million pound in savings that we need to deliver every year, simply to break even.
And finally, on a more light-hearted note, reasons to be cheerful, Kevin. If you remember, this is where I ask you what your reasons to be cheerful are for this month. They may be personal, they may be in your work life. Have you any reasons to be cheerful at the moment?
2 reasons to be cheerful. Firstly, my football team won the Champions League a couple of weeks ago. That's Liverpool, so that made me very happy. But more seriously, hopefully we're now coming out of the winter period. Hopefully we're starting to see a reduction in emergency pressures, and it will allow us to really focus on your question you asked early in the interview, Russ, which is really how we deal with the elective flow and make sure we don't cancel any elective activity.
Kevin McGee, Chief Executive Officer at East Lancashire Hospitals Teaching Trust, thank you for taking the time to answer our questions.
Thank you, Russ.
A huge thank you to all of those who submitted questions to Mr. Kevin McGee. Please continue to send in your questions to the email address at the end of this presentation. Remember, of course, that the Trust has a robust complaints procedure and that the Patient Voices Group cannot enter into individual complaints in these blogs. However, if there is an issue which might affect patients or staff, then please do get in touch. On behalf of patients across East Lancashire, I'd like to take this opportunity to thank the Trust and its staff for taking good care of us. Until next time, wherever your journey of life takes you, have a good trip.